million brain cells die every minute during a stroke, increasing the risk of permanent brain damage, disability, or death. Since May is National Stroke Awareness Month, we're learning more about stroke risk factors, awareness, and prevention. Joining us now is Dr. Michael Gebel of Secours Neuroscience Center. He's here to talk about stroke and racial disparities. First of all, explain what a stroke is.
A stroke is when an area of your brain actually loses blood flow, and blood is carried by arteries. So one of the arteries becomes blocked up, and that blockage causes lack of oxygen and lack of nutrients to an area of the brain. So what can happen is that area of the brain stops living, it just dies. Another type of stroke is a hemorrhagic stroke, a stroke where blood actually leaves the blood vessel and damages the brain cells by actually bleeding into the tissue itself.
Right. So stroke isn't actually a disease, it's more of an event?
Yes, it is an event that occurs over many years before the event actually occurs. It's a disease that we have starting now in life, and then you have the event later on in life.
Right. And when it comes to stroke, are there certain ethnic groups that may be affected more so than others?
Yes, people of African American descent are particularly at high risk for stroke. You have about twice the risk of a Caucasian person of having a stroke. It can occur younger in life. So if I expect to have a stroke at the age of 65 if you're Caucasian, it might happen at the age of 35 or 45 if you're of African American descent. And in the African American population, the strokes are particularly worse. So you have young people having strokes that are worse and more disabling.
Wow.
And so there's a tremendous burden on the community of these poor individuals who've had a stroke and now are saddled with the inability to take care of themselves.
Is there any explanation for why that is?
There's no true explanation, but we have some hypotheses. First of all, you have to deal with risk factors. There are about 5 different risk factors that we account. One of them is hypertension. 1 in 3 people of African American descent have hypertension, so this is something that you need to know about. And we sound like a broken record in the medical community, but the reason why is because people just don't get it. You need to go to the doctor, have your blood pressure taken, and see if you're hypertensive. The second risk factor is smoking. Smoking quadruples your risk of having a stroke. So if you stop smoking today, you can actually decrease right away your risk of having a stroke. Diabetes, and diabetes is an independent risk factor for stroke. It is particularly high in the African American community. And not only does stroke occur more frequently in diabetics, the strokes that diabetics get are worse than non-diabetics. There's an independent genetic factor of sickle cell anemia, and sickle cell anemia causes blood cells to actually deform, and they can get jammed in the arteries that carry blood to the brain, and that can cause a stroke. And the last one is obesity. And obesity is the one thing that when a patient comes to my office, they say to me, "Doctor, what can I do to prevent myself from having a stroke?" And I say, well, right away you can take care of your diet. You can eat low sodium foods, decrease the amount of fat you eat, and get off the couch.
Right. So it sounds like there are certain health things that you should monitor, and also with diet that can affect having a stroke, avoiding that event or trying to prevent
Absolutely.
it. Now, what should someone do if they believe that they're experiencing a stroke?
If you're experiencing a stroke, act fast. FAST isn't an acronym. It's a memory tool for face. If you have any asymmetry or twisting of your face, drooping of your face. The A stands for arm. If you have any changes in either strength of your arm or sensory changes in your arm. The S stands for speech. You can have slurring of your speech, lack of speech, or even confusion. And T is for time. Time, get to the hospital. Call 911. And please, don't think that you're not having a stroke if you're having a stroke. Let us in the medical community make the decision. The worst thing that can happen is you can visit the emergency department. We'll see you. We'll send you on your merry way. But if you are having a stroke, time is brain.
Right. So don't sit on it and think that it's nothing. Make sure to get it checked out and be on the safe side.
Absolutely.
All right, sounds good. Secours Neuroscience Institute, American Heart Association, American Stroke Association, Hampton Roads Power to End Stroke Jazz Brunch. That's coming up on Saturday, June 7th from 11 a.m. to 2 p.m. at the Murray Center, 455 East Brambleton Avenue in Norfolk. Live music will be by Elements Band. There'll be blood pressure screenings, workshops, expert speakers panel, fitness demonstrations as well. You can RSVP to 628-2611, or you can email marquez.fitch@heart.org. And also Dr. Michael Gebel from Secours Neuroscience Institute. You can contact him at bshr.com/neuro or call 215-3564.